and thank you so much for tuning in to KBTV. I'm Dr. Karlisha Booze. For this week's Wellness Wednesday segment, we're talking to a doctor about the importance of getting vaccinated for the flu. Now, we've already been talking about COVID-19 vaccinations, but it's flu season. And this morning, I'm joined with Dr. Gorby Leon. He's a doctor in the Peach County area with Navicent, Atrium Navicent Health. And good morning. And thank you so much for joining us.
Good morning. Thank you for having me.
Absolutely. So first thing, Dr. Leon, can you tell us what is the flu?
So influenza is a viral disease, much like COVID, but unlike COVID, it's been around for many years, and it changes conformation on a yearly basis, and it's deadly. It can hurt patients that are at risk for complications with several disease manifestations, and it's something that we have to take very serious.
Okay, so when should people get these vaccinations?
The flu season typically starts between late September, early October, and can run as far as May of calendar year. And so I typically advise patients to start thinking about getting the flu vaccine starting in September, and at least continue to push through it throughout the flu season.
Okay, now is it safe to get the flu vaccine?
Yes, it's very safe. In fact, it's also safe to get the flu vaccine along with other vaccines. I know we have a big push for getting the COVID-19 vaccines, and I've gotten a lot of questions from patients about whether I should get the flu versus COVID. And so far, there have been no studies to show that there's no contraindications receiving both of them.
Okay, now is this time of the year, do you predict is going to be worse? Because, you know, already the COVID-19 virus is out there and now it's flu season. Do you think the numbers may increase if people don't act now and get those vaccinations?
Yes, I do think so. You know, last year we didn't have a great flu season in our community. We didn't have a number of cases that presented, and as a result of that, our overall community immunity is lower, which means that the virus can spread a lot faster, given the current state that we're in. So I definitely encourage patients to get the flu vaccine just because of this potentially could be the worst flu seasons we've had in a while.
Okay. Now, I do know that, you know, people may be a little iffy about getting the COVID-19 vaccinations. And we know that the flu vaccines have already been around for so long, but let's just give a scenario where, you know, a patient doesn't get vaccinated, okay, and they're having these symptoms. How do we know if it's the flu or is it COVID?
So they're very similar. Viral diseases in general will present very similar in terms of body aches, fevers, chills, that kind of thing. There are several things that may differentiate between the two illnesses. You know, typically flu, you're going to have consistent, very high fevers. But with COVID-19, you're still going to get patients who get loss of sense of taste and smell. The key biggest feature that's different is typically the shortness of breath. Most patients who've got COVID-19, especially when they present early on in the disease course, are going to have hypoxia, low oxygen levels, and for that reason, a lot of times get admitted because of the need for oxygen therapy. Whereas flu, you don't get that until much later in the disease course, depending if you progress that far. Most of these patients generally have the runny nose, body aches and pains and chills, and eventually can develop some pulmonary manifestations of flu disease in their lungs, but that's much later in the course.
Okay. Now, last question. Now, there have been talks about, you know, when people get COVID-19, that those antibodies are already in their system. So my question would be, if they were to get the flu or even get COVID, is it still important that they get vaccinated after they've come in contact with the viruses?
Yes, only because the natural immunity is always a good thing. So I'm not going to discourage that whatsoever. I think just getting natural antibodies because you've come down with the illness is good, but because of and this is true, especially with COVID, not understanding how long does that person retain those naturally acquired antibodies, it's still important to get vaccinated so that we can continue to protect our communities, especially with the flu. You know, I typically, according to the CDC, recommend patients to get vaccinated about 2 to 4 weeks after, they've come down with the illness, to get vaccinated.
Perfect. Well, thank you so much, Dr. Leon, for just informing us on this important task that people need to go ahead and take advantage of, especially during the winter months. So thank you so much for coming on to Wellness Wednesday.
Hey, are you experiencing algae, mold, dirt, or pollen around the foundation of your home and your driveway? If so, call Reed's when you're in need. Reed's Power Washing Service has next day service available. Select service less than 2 hours. You're thinking, Reed's Power Washing Service is homes, that's all we do. Nah, we do it all. Driveways, fences, porches, and we clean your rides. So call that number on your screen today and get you a free quote.